In 2003, I was diagnosed with HIV, and so I was enlisting to the military as a possible career option. But it was there that I learned that I was HIV positive and didn't think about it, didn't even know that I was at risk, to be honest with you. So I accepted my diagnosis and went on my way when I learned about the news. And so just like many people, you just sort of go through that process of learning how to deal with diagnosis. And but little did I ever know that there was a big community out there of activists or advocates, and didn't know anything about that initially. Fast forward 5 years, and over those 5 years, sort of going through this process of learning how to navigate disclosing your status and just living, right? And so I met someone, just like many times before, except this time that I was being accused of not disclosing my status to the person that I was involved with. The relationship, which was very short, ended, and as a result of me being accused of not disclosing my status, charges were pressed against me. I was arrested, and so I went through the whole process of hearings and having a lawyer and having to show up in court. Ended up had to resign from my job and just face the music of what was about to happen. I ended up taking a plea bargain, which is most likely what happens in a lot of these cases. People plead out because for me, I face up to 10 years in prison. And so you don't want to run the risk of even encountering that or even thinking about it. And so most people do plead out, which is unfortunate. And for me, I wanted it to be over, because you have to understand, when you're in the criminal justice system, it's like a chokehold on your neck. You can't make decisions about your life. You can't move forward. You can't go out and try to, well, I did attempt to find other jobs, but it was very challenging in that in-between time, because waiting to be convicted, waiting to be sentenced. There are days that I woke up in pain, like in my stomach, just because of just how much this bothered me. And so I ended up going to prison for 6 months in Louisiana. Had to register as a sex offender in that state. But now, with all that I know, I would have fought. I would have fought it differently. It was right after I got out in January of 2011 that I knew I needed to do something with my life, but I just didn't know how. But I did know that having a criminal record was going to make it even more challenging. And here I was, having a college degree, actually worked in the courts, the Court of Appeal for the Second Circuit in the state of Louisiana. And yet here I find myself on sort of the other side of the law. And so I went online and found a blog that was about HIV criminalization. And so as I'm reading it, I'm like, wow, this is what happened to me, like word for word. And so as soon as I finished reading, I immediately called the number that was on the blog, who was a colleague, Sean Stroop. And I connected with him, and sort of the rest is history, because it was then, as I was engaging with him, I was introduced to other lawyers and other policy people, other advocates who were involved around this issue then, but they hadn't really met anyone to come forward to talk about it from a real personal perspective. And so it was from there that I began to start sharing my story through another short film called HIV is Not a Crime, and through some other policy meetings in other parts of the world, agencies that were doing, organizations that were doing policy work around this issue. So it was, I would like to say it was like perfect timing, because I think for me, it all just sort of happened right as it needed to happen, I guess, to fall in place. So if you're a person living with HIV and you know that you're living with HIV and you engage in sexual activity, but you do not disclose it prior to engaging in that activity, then you could be criminally liable simply for not disclosing that you're living with HIV. Even if you don't transmit HIV to anyone, which in a lot of these cases, there has been no transmission actually. So people can face lengthy jail sentences. There have been some for 30, 60 years. In some instances, people are labeled as sex offenders. There are states that have HIV-specific statutes. If, for example, Louisiana calls it intentional exposure to the AIDS virus. I will just say some states have gone as far as to prosecute people with these laws and based on, well, what they're calling it bioterrorism. Some have even labeled it under assault, aggravated assault. And what's not taken into consideration is whether I'm on treatment, whether I have an undetectable viral load, whether I used a condom, whether this was a consensual situation. So there's a lot of factors that need to be considered before really just thinking that a person is committed or intentionally committed a crime. Well, the only defense to this is if you didn't know that you're living with HIV. And so it definitely can create an incentive for people to not want to get tested, especially as they learn about these laws, as they learn about seeing how other people are being treated. It goes against the public health strategy or public health message in terms of people getting tested. As I like to say, you can't do both. You can't prosecute and do prevention. It just does not work like that. We need people who are impacted, people who know what it's about living with HIV in leadership positions, in the decision-making positions, because it's the people that are not living with HIV, it's the people who may not identify as gay or queer, or it's the people that are not sex workers, and it's the people who are not trans. And looking at this also as a racial justice issue, and I said earlier it's a social justice, but also through a racial justice lens. Understand that I'm in the South, in Louisiana, where it's the highest incarceration rate in the nation, that most likely if you're Black, you're going to be prosecuted. You're going to face prosecution for anything. And so I can speak to that. But for me, being Black and HIV positive, I mean, it creates the perfect storm. It's unfortunate that in this country, in the US, that it is, yet again, Black people, African Americans, that are feeling the brunt of these laws and policies. There's been great momentum around this issue. We've had the fact that we've been able to change laws in several states shows that there's a purpose for what we're doing. There's a reason. I feel like we still have a ways to go to kind of really see the impact that we made, but just the fact that we've brought awareness to this issue, raised the level of awareness in conferences, because they wouldn't even talk about this issue in the beginning. You couldn't even get a policy person to mention the word criminalization. There's been several coalitions now that exist. We've been fortunate to be able to have our own first ever national conference on HIV criminalization and be able to have at least 3 to 4 installments of that every other year. So I want that, people to know, if they're not aware, that there's a big movement out there. And even for the person that may see this, that are going through it, or some family member or friend may see that they know that there's a connection, that there's a place or somewhere where they can plug in and come to around this issue. Whereas for me, when I first looked it up, there was not a whole lot out there. So it's really hard to find help around the issue.